Welcome. In this video, we will review the 2026 tuberculosis treatment guidelines. Tuberculosis remains a major global health challenge, but with early diagnosis, appropriate treatment, and good patient adherence, most patients can be cured. We will discuss these treatment goals, standard regimes for drug-susceptible tuberculosis, monitoring, adverse effects, and the management of multidrug-resistant tuberculosis. The main goals of tuberculosis treatment are to cure the patient, prevent the relapse, stop transmission to others, prevent the development of drug resistance, and reduce mortality. Successful treatment not only benefits the individual patient but also protects the community by reducing the spread of infection. For drug-susceptible tuberculosis, the standard regime consists of two phases. The intensive phase lasts for 2 months and includes Rifampicin, Isoniazid, Pyrazinamide, and Ethambutol, remembered by the mnemonic RHZE. This is followed by the continuation phase of 4 months using Rifampicin and Isoniazid, remembered as RH. Therefore, the total treatment duration is usually 6 months. Adherence throughout the entire course is essential to achieve cure and prevent resistance. Patients receiving TB treatment should be monitored regularly. Clinical improvement is assessed by looking for the reduction in symptoms like cough, fever, weight loss, and night sweats. Weight gain is often a sign of successful treatment. Healthcare providers should assess medication adherence, monitor sputum results when indicated, and watch for the drug related toxicity. Regular follow up helps ensure successful treatment outcomes. Understanding adverse drug reaction is important during TB treatment. Isoniazid may cause peripheral neuropathy, which can be prevented with pyridoxine supplementation. Rifampicin commonly causes orange discoloration of urine, tears, and sweat, which patients should be informed about in advance. Pyrazinamide may lead to hyperuricemia and joint pain, and ethambutol can cause optic neuritis, resulting in visual disturbances and impaired color vision. Patients should be encouraged to report side effects promptly. Multidrug-resistant tuberculosis or MDR-TB is defined as resistance to at least rifampicin and isoniazid. Management is more complex and requires specialized treatment regimes. Patients with MDR-TB should be managed by experienced healthcare teams and monitored closely throughout treatment. Early diagnosis and strict adherence are critical for the successful outcomes. Patient education is a key component of tuberculosis management. Patients should be advised to take medications regularly at the same time each day and never stop treatment early, even if the symptoms improve. They should report any side effects promptly, maintain good nutrition, and good adequate rest. Infection control measures like covering the mouth while coughing and ensuring proper ventilation help reduce disease transmission. MDR-TB requires individualized treatment based on drug susceptibility testing. Eligible patients may receive a shorter all-oral regime lasting approximately 9 to 12 months. Common medications include bedaquiline, fluoroquinolone, such as levofloxacin or moxifloxacin, clofazimine, pyrazinamide, ethambutol, high-dose isoniazid, and ethionamide or prothionamide. Patients who are not eligible for shorter regimes may require longer treatment courses lasting 18 to 20 months or more. Recent WHO recommendations include shorter all-oral regimes such as BPaLM and BPaL. BPaLM consists of bedaquiline, pretomanid, linezolid, and moxifloxacin. And BPaL includes bedaquiline, pretomanid, and linezolid. These regimes have simplified treatment, reduced treatment duration, improved adherence, and achieved higher treatment success rates in appropriately selected patients. Treatment selection should always be guided by drug susceptibility testing, patient's characteristics, and national TB program recommendations. The key messages are simple. Early diagnosis saves lives and prevents transmission. Patients must complete the full course of treatment. Good adherence prevents treatment failure and drug resistance. Side effects should be recognized and managed properly. By working together, we can reduce the burden of tuberculosis and move closer to ending this disease. Recent To summarize, drug-susceptible tuberculosis is usually treated with a 6-month regime consisting of RHZE followed by RH. Careful monitoring and patient counseling are essential. MDR-TB requires specialized management and may be treated with modern all-oral regimes such as BPaLM or BPaL. Thank you for watching Clinical Concepts with Dr. Atifa. And if you found this video helpful, please like, share, and subscribe for more medicine and infectious disease tutorials.